a discussion, and I've got some food bits and pieces to talk about. And I've actually tried practicing some of these ideas cooking myself, because I baked some bread today and learned a useful lesson which my wife told me I should have done many times before. Weighed the dough and made sure it was the right sizes. So, you can always learn from others when it comes to food and sharing ideas. I think the culture of sharing food is a useful one. So I'm going to briefly tell you what the current recommendations are. I was involved in writing the Diabetes UK ones, but trying to make them practical things that might help and hopefully will help. The first one, I remember being taught this as a student, and I actually did my student training between mainly at Leicester Royal, but also at the General Hospital and a little bit at Glenfield. So I learned a lot about different approaches there. And this is a simple acronym of FAT, or frequency, amount, type. Before I do that, I think the important thing we need to think about, there's not one way of eating for people with diabetes. There's multiple ways. The research shows there's not one answer. And it's about finding the best way that you can enjoy eating food. And remember the word enjoy eating, because it's a lifelong thing. It's a long run thing. We talk about different ways of looking after diabetes, and there's a lot of research and a lot of things written about remission of diabetes and putting the diabetes back into sort of normal glucose levels. And that can be achieved a number of ways as well. And a lot of the stuff we talk about is linked to weight loss, but we need to think a little bit more carefully about that, because not everyone with type 2 diabetes is overweight. So what does that mean? I think a simple way of looking at it is looking at where we add extras into food. And that goes through the guidelines and the diet patterns that are recommended, go from Mediterranean diet to sort of these high fruit and vegetable diets to even some of the low carbohydrate diets. It's when you're adding extra sugar, fat and salt into food, which possibly above what is necessary. And also if you're looking at refined foods, do you want me to come a bit closer? Is that better?
That's better, thank you.
Yeah, I'll lean into it a little bit. So just because in the kitchen it's a bigger room than normal. And enjoying what you eat is important. So this idea of fat, or frequency, amount, type, it's nothing to do with diet fat. It's the idea of what we think about foods before we make decisions about them. So I think the first thing is looking about how often we eat something. If we eat a food once a year and it's a small amount, we don't really need to think about how much fat or sugar in it. It's not as important. But if it's something we eat every day, that's when we might think, is there a better choice, or is the portion size something I can look to moderate? That goes along with the amounts. So how much do you eat of a food? And it's actually thinking, well, can I change the portion sizes? And sort of when we get to into discussion, I can show you the bread I made today. I made the same amount of dough, but I made an extra 6 bread rolls out of it. So I'm going to make an extra 2 meals out of the same amount of dough. So the amount of carbohydrate, the amount of calories, depending on the fillings of the sandwich, will be less. And then the type. And often when we talk about diet and you read things about diet and diabetes, we're told to change the type. Do you change the type of milk? Do you go for a lower fat milk, or do you use a different fat in your cooking? That's probably the lowest on this list, because if you look at how much you use first and how often you use it, we can look at turning some of the messages we get about diabetes a little bit on the head. For example, when I cook with spices, I quite often use ghee because I know it gives a better flavour, richer flavour from the onions and the spices, but I use a very small amount. And I'll look on giving you some tips on measuring and giving guidance to that in a moment. But if I'm using other fats for cooking, I tend to use maybe an olive oil or some sort of those sort of oils to look at the type. So I use the appropriate type for cooking, use less of it. So I've used the example there, if you don't drink beer, it doesn't matter if you have a low calorie beer or a normal beer, you don't drink it. So the type is possibly the least important thing. And that's, if you look at this idea, we encourage people in a lot of messages we get, whatever dietary message you're looking at is eating more vegetables and looking at how we can incorporate more of them. And that's because they're low energy and they can bulk up meals, so we should eat them more often. Whereas possibly things like chocolate, which Keith mentioned, I did my research in, we use small amounts of that and enjoy it for what it is rather than eating large amounts. The effect of cooking, sort of, it's one thing we don't necessarily think about, because some foods will soak up a lot of fat when we cook them. So potatoes and aubergines and mushrooms, if you put them near any sort of fat or oil when you're cooking, they soak it up like a sponge, so they become very greasy and it adds a lot of calories to them. So if we think about these sort of foods, they're boiled, steamed, you know, they're low calorie, but as soon as we sort of add in their fat, they soak up a lot of fat. Also, if you're looking at things like frying foods, whether we're talking about potato or sort of rice after it's been cooked, it removes water from it. So it doesn't just soak up fat, it removes water. So I put in there, so 3 bowls of boiled potatoes will have the same amount of calories as 1 bowl of chips. So it's thinking what we're doing to the food. But the good news is we can add fluid into there. So soups and gravies are more filling. So if we look at things like rice or pasta or lentils and dals, they soak up a lot of water, so they give us more bulk. So if we can use this idea to give us more bulk in the food we eat and try and think about how we can cook so that it doesn't soak up a lot of fat or concentrate it down. And I've got an example here of the grapes, because I think that's a question I get answered quite a lot, or asked quite a lot when we finish this, to have a look at that as an example when we try out foods as well. Carbohydrate gets a lot of conversations in diabetes, and I get asked a lot about low carbohydrate diets, and I'm happy to talk about that in the questions. But I think the first thing is being aware of where these foods are, which foods contain carbohydrates. So most fruits and tropical fruits tend to have slightly more carbohydrate than sort of the berries, but also dried fruit, because you're reducing the size of it and driving out the water, but keeping all the carbohydrates and the sugars there. It's natural, yes, but they can be very concentrated. And I've got an example to share with you after this little introduction. But also we have things that we're more aware of that contain sugar, like the cakes and the chocolates. But then we've got the sources of starchy carbohydrates, the cereals, the breads, the pastas. And generally the less refined are better. But if we know which foods contain them, we can control the amount. So if we choose to eat less carbohydrate, we can do. Or if we want to try a lower carbohydrate diet with guidance, we can do. I put a very important message in there that if you are wanting to reduce the amount of carbohydrate, particularly if you're on insulin or certain medications, you need to talk to your diabetes team first, because it can increase your risk of hypoglycemia, low blood glucose. So it can be an effective way for some people to manage their diabetes and manage their weight, but you need to do it carefully because it can interrupt with the medication. And I think one of the things that I came across in practice a lot was when you sort of have multiple sources of carbohydrate and people aren't aware of it, and that can lead to higher glucose levels. The jacket potato and baked beans, I remember as a student, everyone used to go, it's the sugar in the baked bean juice that's the problem. Now it's because you're having 2 sources of carbohydrate together, and sort of potato in a curry example, or things like lasagna with chips. So it's being aware of where these foods are, then you can control them and reduce them if that's appropriate for you as your management. I think portion size is a simple one, and this is the simplest one I can find, and it's one I use a lot. And if you're looking at sort of things like size of potatoes, the potato I've got here is a bit small, but it's the size of a clenched fist. If you're looking at vegetables, it's 2 handfuls, and that's a good way of sort of giving a portion size for sort of a meal. And if you have 2 handfuls at 2 meals a day, it's a good way of getting a good way to your 5 a day. And then you've got sort of the meat alternatives. That's right, the palm, the thickness of the palm is a way of looking at it. And then if you're looking at adding fats, it's the tip of the thumb, and cheese probably about the size of the length of the thumb. So that's roughly a tablespoon and a teaspoon. Gives a good idea. It's a teaspoon per person is a good way of controlling that fat and using it appropriately to flavour food. And again, hopefully I have a chance to talk about that a little bit more. And then, I sort of remember this. This is a quote I remember from Miss Piggy about not eating anything bigger than your head. But in practical side, and I've taken 2 pictures, if you go from a 20 centimetre diameter chapati down to a 14 centimetre diameter chapati, the 14 centimetre one is actually half the size, half the weight, although it's only 6 centimetres, so smaller across. So it doesn't actually look significantly smaller, but it actually is. That's just a bit of maths that I was playing around with as an example. And it's looking at, if you are eating out or sharing foods, if you share it in a thoughtful, mindful way, you can actually enjoy more foods, but possibly control the portions more. It's tricky sometimes when you're eating out and celebrating, but if you look at how you approach with your mindset, you can actually take that to your advantage and sort of thinking how you combine foods together. So a few tips before we take it up and look at a few examples, and I'll share the great one first before any questions, is remembering little changes can add up. It's being aware of what you can eat and trying to enjoy eating food in a mindful way, because that can also help improve your health. Be aware where the carbohydrates are, because these are the things that are going to have the biggest effect on your blood glucose. And you can help sort of gain control by sort of being aware of the portion sizes and controlling those. This idea of doubling up on carbohydrate-rich foods, that can catch people out sometimes. And trying to eat these more what we call nutrient-dense foods that are lower in calories, such as vegetables, particularly the leafy vegetables, and sort of using things like dals as with the liquid in there and the sort of gravy to sort of bulk out meals. And remember, we need to enjoy what we eat, because this is a lifelong thing. So I'm going to stop sharing my screen and just share this little thing with the grapes, which I've got set up here. Hopefully you can see this. So this is, I'll tilt my camera down so it looks, get the camera in the right place. So this is 12 grapes, okay? If you dry them and turn them into raisins, we've got to find them on the camera, it's really hard to see. But that is the same number of grapes as raisins. So I'll show you the grapes again, yeah? That's probably a portion. If someone gave you that, would you be disappointed? But there's the same amount of carbohydrate and sugar in both of those. And that's just thinking about when we look at food, being aware of how it's changed and what's in it and how that can affect sort of, not necessarily sort of the nutritional value, because they're similar apart from the water, but how we interact and how we think about it.